So this sequence will show hands treatments for volume and surface skin quality improvement. We're using Pluryal volume to rebuild the volume an aging hand is losing. And secondly, we are doing mesotherapy with Pluryal booster to improve the skin quality. Typically, the hands of our patients show the signs of aging. So the skin quality gets or the skin loses its quality. It gets thinner, less hydrated, little wrinkles show up, and the overall signs of UV exposure, such as freckles, appear. Looking at the volume loss over time, we can see that the interdigital spaces deepen, the veins overexpose, and the overall look gets more skinny, and at an elder age, it might even look skeletonized. The strategy here is to refill the interdigital spaces. We're using a 25 2-inch cannula from one entry point, because like that we are able to fill the every interdigital space. So the entry point obviously is at the proximal site, and the areas to be filled up are again the interdigital spaces. Avoid the veins. We are running we're running below the veins, obviously, and we're very conservative in terms of amount of volume we're injecting. Again, the entry point is numbed with a little local anesthesia. Secondly, we do the entry point. Trick is to tunnel the way. Directions we will go later. We then use Pluryal volume, which is mixed with 50% of silicon, 1% in this case. We use a blunt-tipped cannula. We prime the cannula, never inject air, and see how well the filler sticks to the end of the cannula. This cannula has a hub marking. I want to have the hole at the tip of the cannula pointing down. Into the interdigital spaces, and we place the filler again in a retrograde fashion. Stretch the skin. So if there is any resistance, we respect this resistance and redirect in a subdermal space. And that's one now. Molding the Pluryal volume in. The objective of this treatment now is rejuvenation and revitalization of the skin with Pluryal Booster, a non-cross-linked hyaluronic acid product of 80 milligram per milliliters. So the product will be injected in different mesotherapy techniques, such as the nappage, the very superficial injection by pricking the skin very superficially, bevel up in a crosshatchwise pattern, covering the whole surface. For a more pronounced rehydration and revitalization effect, we do the deep injection point by point technique. To finish, we do mold the area injected with Pluryal Day cream. After especially the filling procedures on hands, we advise our patients to either make a fist and drive their car for the next hour, or sit on their hands in order to get the treated area well, in order to get a good result. We secondly cool the area by cool pads, or we do put 2 gloves on filled with ice cubes in the middle. This is the treatment concept for hands by Pluryal volume to fill the interdigital spaces with volume and to rejuvenate and revitalize the hands by Pluryal Booster. The deep volume augmentation treatments are typically done once per year. The Pluryal Booster mesotherapy has to be done in a protocol in the following protocol: 1 treatment per week, 4 to 6 treatments in a total. And very importantly, a sunscreen has to be applied the whole year through.